Um, I've been talking with folks for a little more than a year about health care reform, when it was sort of a twinkle in the federal eye, looking at what was it going to be like, what was the likely shape it would take, and what did it need to be if it was going to address the big problems in health care. I think we probably all agree that there are three of them. One is that health care costs a heck of a lot. Two, that despite what we pay, as John said, we pay more per person in the United States for health care than any other country in the world. Despite that, our health care is not high quality. It's not reliable, which is really problematic. So we have a big problem with cost. We have a big problem with quality, and part of the reason why it costs so much is because the quality is not consistent. And the third problem is access. We have, as John gave you the numbers, we have too many people who are uninsured. I think we all have the sense that we witnessed history on March 23rd with the passage of health care reform. It was a big moment for everybody. It was a culmination of a year of very intense and emotional debate. I do want to say that my organization, Independence Blue Cross, and in fact our industry, is strongly supportive of reform. And I'm sure that's going to make some of you snicker and think, heavens, that can't possibly be true. But if you think about it, why wouldn't we be? The biggest issue we have as an industry is the cost of our product. And what drives the cost of our product is the cost of health care. So we would be foolish if we weren't incredibly enthusiastic about an opportunity to reform a system that we all agree is broken and that we all agree is not working. So we were very excited that the legislation took an enormously progressive step towards increasing access to health care. John gave you the numbers. I mean, 30+ million people, according to all estimates, are going to be covered by 2018, 2020, when all the provisions of the Act have taken effect. But it's disappointing that our country missed an opportunity to, at the same time, really address the issues of cost and of quality. And to the degree that you saw us and our colleagues expressing reservations about the law as it was developing, it was because there was enormous fear that the structure of the legislation was in fact going to lead to costs going up and not to costs going down. And that's problematic under any circumstances, but it's particularly troublesome if you're adding 30+ million people to a system, which is therefore going to continue to, just by sheer volume, going to continue to ratchet up the costs. So I've watched, as people that I come in contact with, and I'm sure you feel the same way, that people are pretty confused about this bill. Is it a plus? Is it a minus? And I happened a couple of weeks ago to go to an event at which our area Congresswoman Allison Schwartz introduced Health and Human Services Secretary Kathleen Sebelius. And I was fascinated to hear Congresswoman Schwartz say that now that the law has passed, whether you're rich or poor, young or old, insured or uninsured, the law would guarantee that you would have access to affordable health care. And I found that a really stunning statement, because if you don't have to be too knowledgeable about the law to know that affordable is not really a key part of it. And on the other end of the spectrum, you have our attorneys general. There are 18 of them, 17 Republicans and 1 Democrat, who are suing the federal government and really opposed to the law, and saying that either it unlawfully mandates that people have insurance, or that the requirement, ultimately the states are going to have to shoulder a lot of the cost of the Medicaid expansion. So that's another reason why people are suing. And the Republicans, of course, are saying that the goal is to repeal the law and perhaps to take back Congress in the midterm elections. So those are the two kind of ends of the spectrum. And I heard a story this morning on KYW, maybe you heard it, that White Castle, the hamburger heaven that makes those little square hamburgers that some people are just totally nuts about, that as part of a fundraiser for a nonprofit, they've made a candle that has the fragrance of White Castle hamburgers. I'm not going to run out and buy one, maybe you will. But I hope I don't sound like too much of a cynic when I say that reminded me of what this healthcare reform bill is, because it has the fragrance of reform. But when you really look at what would need to happen to make your cost of health insurance go down. I don't think it's happened yet, and it is of concern. I like to look at the price tag. It's $940 billion, and say, well, what is it we're paying for? Half of that money, $506 billion, goes towards the subsidies for individuals and the tax credits for small businesses to be able to afford health insurance. And I think we would all agree that if you're going to mandate health insurance, then absolutely you need to provide some help to businesses and to individuals who can't afford it. But that piece, my point I'm trying to make, is that it's aimed at access. It's widening access. It doesn't address the quality issue. It may not address the cost issue. $440 billion is the price tag of putting those 15 to 18 million on Medicaid. And that's, again, increasing access. Now, it will also give people access to health care, which is extremely important, that young people, that adults get access to preventive care, which will keep them well and not have things escalate out of control. So that's definitely a positive. But John was very careful in outlining for you some of the efforts that are made to reform how physicians are paid or to increase quality. And if you add up the two pieces I just gave you, $506 billion for the sort of premium assistance and $440 billion for the expansion of Medicaid, then the programs that are in there for quality and reducing costs are kind of a rounding error. Now, in the government's defense, all it can really act on is Medicare and Medicaid, the programs that it controls. And there are some remarkable pilot programs, which I think John was talking about, in the law that will happen with the senior population to begin looking at alternatives to improve quality and hopefully to lower costs. But it is not a substantive part of the legislation, which is of great worry to us and I would imagine probably to you. The other concern is that there are a lot of things in there that are going to immediately increase costs to folks for insurance, other individuals, and for companies. That's something that our industry has been looking at and has been sharing studies with the federal government. And again, they've kind of been sneered at. But I was fairly interested on April 23rd to see that once the law was passed, the HHS took a month to look at it and came out with a finding that it would achieve the administration's first aim of expanding access, but that it would not achieve the second aim, which is controlling runaway costs. And in fact, even the HHS predicts that spending is going to go up by 1% over the 10-year period of the law. So what we have been up to, like probably most of you, is we have been aggressively trying to figure out exactly what is in the law and what is its impact going to be on our customers and on healthcare providers who are in our network. We know that there's a lack of clarity now because the regulations, most of them haven't come out from HHS. We were on a call this week. My colleague Ruth Stulman was on this call finding out exactly when the regulations are going to come out, and some of them are expected in the next couple of days, which will be a big help for all of us. The implementation process is really lengthy. I mean, it's going through 2018 at the outset. I mean, at the minimum. Given the likelihood that the bill includes legislation that is going to impact our customers, we're very focused on figuring out how to modify that impact on people's premiums and how to understand the law so that we can work with our customers to make sure that they're aware of what's required and also keeping an eye on not increasing costs that that can be involved, that can be avoided. Basically, we are looking forward with great enthusiasm to the time when Congress actively turns its attention to improving healthcare quality, because for all of us in that room, that's going to be a real bellwether day. So in bottom line, I think we're very relieved that Congress has taken this innovative and progressive step towards expanding coverage within the country, and we think there's a lot of work that remains to be done with improving quality, and a lot of work for us with working with our customers to figure out exactly how to implement the law. Back at you.
Boy, you did a great job. You brought us back from a time standpoint. So we are really, really hanging in there very well.